Who received the award for Innovation Program of the Year. So congratulations, David.
It's all about the team.
Yes. So I do now want to recognize Craig Walker, who is the Vice President of Advocacy. He's going to introduce our speakers today.
And I want to invite everybody to make sure that you stay at 2:30. We'll have Meet the Policymakers, and it's a good time to ask questions and to get together with those who do make policy. So we hope that you stay for that little reception. As you know, there's always change going on in our systems. So we would love to call to the podium our first two speakers, who is going to talk about what's new in DD land. And I would like to introduce Alan Showalter and Janet Steffen to come in with the department to give us some updates. So you're going to have to come around this way.
Good morning, everyone.
Good morning.
I'm Alan Showalter. I'm the Deputy Director of the Medicaid Division at dodd, and with me up here is Janet Steffen, who's our Development Administrator. I want to start just by thanking the ARC for having us here today, and for all of you for joining us. David and Craig are right, there are always things changing here. And I was going to say, it feels like there's a lot going on that we're going to update you on today, but it always feels that way. So here are, we're going to talk about things, some recent changes, some changes to come, and some changes kind of to come out of the further future as well. So I'm going to start with our most recent changes, if I can operate the clicker correctly. So we had some July waiver changes that just went into effect at the beginning of this month, that I hope you are all aware of. First is the rate increases. So following our January waiver amendments and the July Houston budget from the last budget cycle, the second phase of DOD's rate increases for many of our home and community-based waiver services took effect on July 1st of this year.
Yay!
DOD has been committed to increasing compensation, supporting the direct care workforce, and the work that all of you and the ARC did through the last budget cycle was really instrumental in helping secure those rate increases. And we have at least been hearing anecdotally that they have been making an effect on the direct care workforce. So I hope to see that continuing in the coming months as well. We made some other changes in July as well. First was creating new outcome-based payments for our employment support and career planning services. So DOD certified providers who offer individual employment support or career planning now have the opportunity to earn these outcome-based payments in addition to their regular payments for this service as well. Providers can earn these additional payments by achieving specific job placement or job retention milestones for individuals who are receiving IES or career planning. Our goal with these updates is to encourage quality outcomes and long-term employment support. I'll talk a little bit more later about what else we're doing to encourage employment support as well. But I'm excited about this kind of first step into these outcome-based payments. I hope they are successful as well. We also made some changes to our specialized medical service. We edited definitions and provider qualifications in the rule, including additions like defining repair and maintenance and useful life, to hopefully make it easier for SSAs, for providers, and for families to identify when equipment needed to be repaired and when waivers could be used to replace it equipment as well. So we're hopeful that those services, or that service will be clear for individuals as well. The final update in July was we expected a new service to go forward, our healthcare assessment service. And this was built off a pilot that some of you may be aware of, where Station MD is providing a telehealth assessment service to individuals both on waivers and ICFs. We put that into our proposed waiver amendment, and CMS had some questions and concerns and asks us to pull it out to work with them a little more to make sure that they were comfortable with the service before it's approved. So our goal is still to include that in a January waiver amendment. But right now we're continuing the pilot for anyone who had been participating beforehand and receiving the service. Individuals are still able to receive those services right now, just not through their waiver, through DoD funding instead. Now on to some changes to expect in the future. And I want to start with our waiting list rule. So several years ago, we created the updated needs assessment or waiting list rule to kind of identify the services or needs an individual has when they come to a county board in need of services. It's time to update that rule, and we're doing it in 2 phases. The first phase, we've been working with the stakeholder work group, which has included providers, individuals served, families, the ARC, and some other associations, county boards, to identify what needs we needed to update in the rule. And so phase 1 has some additional guidance on when county boards should administer the tool. We found that we needed some clarity for families and for county boards on when the tool should be administered. So whenever somebody is going to present to a county board and say, I have a need, they should be given a waitlist assessment. We're also updating the process by notifying individuals and families about the waitlist assessment, making sure that counties are providing copies of the actual waitlist assessment that's completed to families, and explaining the due process provided to them as well. This should be effective in November of this year. And so then we will have phase 2, aiming for a July of 25 effective date, where we'll make some more changes to the tool and the rule as well. So phase 2 will hopefully coincide with the launch of a new waiting list management system for the department that county boards will use to input the waiting list system. We will be adjusting the definitions of current needs and immediate needs as agreed upon by the work group. Adding 2 situations to the list of reasons why an individual could be removed from the current waiting list. The county boards brought us saying, they're kind of in limbo when these situations occur. And we'll be eliminating the appendix to the rule to coincide with the redevelopment of the system. So right now, the waiting list tool, the actual assessment, is an appendix in the rule. We don't have any of our other tools or assessments in rule like that. And so we're going to move it out of the rule so that if we have to make changes to make sure that the tool is working as required by the rule, we can do that without having to go through the rulemaking process. If we had to make any changes to the rule, of course, or to the tool, of course, that would require changing the rule. We would go through the public rulemaking process for that. The next topic is one that I have been hearing a lot about lately, and I'm sure you have been thinking a lot about lately too, is electronic visit verification, or EVV. So EVV has been around for a number of years now, and it's, as its name implies, an electronic system to verify that certain home care visits are occurring as they are being billed for. ODM recently re-procured, and this is an Ohio Medicaid program. ODM recently re-procured its program, and has, with its July launch of this updated program, had some program changes that I want to make sure that we're all aware of. First, that they have a new process for a live-in caregiver exemption with the person you're providing services for. You're not required to use EVV for those services. And for DoD services, excluding shared living, that there is a waiver or there's a caregiver exemption form that you can complete to ensure that you're not required to complete EVV for those forms. Because shared living, everyone who's providing the service lives with the individual they're providing services for, you're not even required to complete the exemption form for that just by providing the service, you obviously meet those requirements. The new program also limits the use of GPS. So you have to have an individual's consent to use GPS in EVV now. There's a process to go through for that as well. Otherwise, you will indicate whether the service is being provided at home or in the community in the application, and that is the verification portion of that instead of GPS. Yes, I know I heard from a number of interested individuals that they had concerns about the GPS exception, and so allowing individuals to opt into GPS in this way is their way of making sure that people are not being forced to use GPS if they're uncomfortable with that. And finally, for individuals who are using our participant-directed services, our FMS, which is GT Independence, is required to capture EVD as an alternate vendor now, going through the certification process. And so individuals who are using GT Independence and providing participant-directed services will be able to just use EVV as part of that process rather than having to use a separate EVV and a separate FMS billing system. They'll all be able to be done at once, which I think will also be streamlining and easier for individuals and providers as well. The other big news that ODM has recently announced regarding EVV is that there will be future claims adjudication requirements. So in order to, in the future, not now, to be able to bill for services that require EVV, you will have to have a successfully verified visit in order for those claims to be paid. ODM has announced that it's going to start, it's going to have a phased-in process for this, and it's going to start with state plan home health services. So no DoD waiver services will be part of that first phase. But I would encourage all providers who aren't yet using EVV, which I hope you all are, to make sure that you're familiar with that and using the process successfully, so that when it comes time for DoD waiver services to be part of that, it's an easier transition for everyone involved. So finally, maybe, I talked earlier about the outcome-based payments we created for employment services. These were a part of our larger adult day employment service blueprint project, which has a number of projects going on to kind of update our day service and employment services array of services. I want to talk about a couple of those changes today as well, a couple other of those changes today as well. So first, we have a couple of pilots going on that have been using ARPA dollars, the Federal American Rescue Plan Act funding, to try and promote some change in our system and improve some quality. First is our Adult Day Quality Pilot Program, which is using direct investments to providers and quality incentives to help build adult day provider quality and capacity, enhance the quality of services that are being provided there, and improve the person-centered outcome and access to those services, especially for individuals with complex needs. We have heard time and again from families about the struggles to find adult day services for individuals with complex needs. So that pilot is ongoing. We are collecting data in this first year of it, and then proactively reporting outcomes to us in the second year of it. And we're thinking then about how to develop a proposal to sustain some aspects of that program as part of a waiver service down the road, but not obviously while the pilot is still ongoing. We also have an Employment Quality Readiness Project, which provided over $450,000 in capacity building grants to providers as well, to over 43 providers, to correspond with the career planning individual employment services services that they are providing and helping to build capacity for those services as well, because we hear also time and again from individuals about the desire to work and have a job, and so we need to improve our employment services to help people down that path to employment as well. And so we have 3 planned waiver changes coming forward from Blueprint as well. The first 2 I want to talk about are changes to the group employment support service, which is group employment is a supported employment experience in groups, and we're going to create incentivized ratios for people with significant needs to help those individuals participate in group employment as well. And we are planning to create the basic employment skills training service as a new waiver service, or we're going to call this BEST. This will be a pre-vocational skills training service. It's time limited to 2 years, but will allow for extensions based on unmet needs. So individuals will be able to continue in the service if they still have a need for the service going forward. Finally, and happening the soonest, hopefully, will be a new rate for our non-medical transportation to competitive integrated employment. So within our NMT service, we heard from individuals about the struggles to find transportation to employment. And often these were one-on-one rides because individuals were going to a community job where they were the only individual working there at the time. So we're creating a new rate specific to providing transportation for individuals who are going to competitive integrated employment, and we hope to have this effective on January 1 of 2025. So this will go into our next waiver. The other big changes that we're going to talk about are coming through our waiver modernization project. Janet is leading that project for us, so I'm going to turn it over to her to talk about some of that, and we'll be happy to take some questions at the end.
Thanks, Alan. Good morning, everyone.
Good morning.
Good to see you. Wanted to give you some updates on the waiver modernization project. I think I presented to this group at the very beginning of the project, which started in early 2023. So just want to give you some updates on some of the work that we've done and the work that we're looking to do in the future. So a quick overview of the project is this is a project we're engaged with Deloitte Consulting to help us navigate, modernizing, simplifying, streamlining various components of waiver services. So what we've looked at so far is how waivers are funded. So we are working with our county board partners to look at ways to enhance waiver accessibility as well as to limit risk associated with high-cost waivers. So that's some work that we've been doing with them and continues. Additionally, we've done a national scan of 2 target service areas, shared living and remote supports. And the reason for that scan was to learn from other states and identify opportunities to improve or enhance the services that we currently deliver. So we've received some feedback and are considering some options as we look to update the remote supports rule. Many of the changes that you saw to shared living were enhanced along with post-pandemic updates. And finally, and most recently, and probably of most interest, is we took a look at the assessment process, namely the ODDP and the AAI, and are working through ways to improve this process. So let's see if I can successfully work with her. There we go. Just takes me a minute. Okay, so we started looking at the ODDP last spring, and our first step was to gather some feedback from all of our stakeholders, persons receiving services, families, county boards, to get an idea about experiences with the ODDP, what they liked about the process, what wasn't liked about the process, to help inform where we needed to go next. It's no surprise to any of you, we heard a lot more negatives than we did positives about the experience with the ODDP. So we took that into consideration and then began looking at assessment tools used in other states. And these are tools that either help inform service planning, help identify individual acuity, help inform acuity-based rates, or all three. So we spent several months looking at tools in other states, as well as talking to other states about implementation, what barriers they experienced, what feedback from persons served in those states was, to help us consider what our next steps should be. So after all of that review, we determined that we would like to explore using the Supports Intensity Scale, or the SIS, which is used in, I want to say, 11 other states to help inform acuity. Other states use it for other components as well. So let me tell you a little bit about the SIS. The SIS has been around for a long time.
I don't think everyone in the audience knows what the ODDP is.
Oh, okay, well, thank you for that. I assumed everyone did, so that's my mistake. The ODDP is the Ohio Developmental Disabilities Profile. And for folks utilizing the IO waiver, it is an assessment to determine your acuity score, which determines funding ranges. So, in a nutshell, it is one of many assessments, I'm assuming everybody participates in. The AAI is a tool used for adult day services. Functions in a similar manner. It is a tool that determines acuity, which determines funding ranges as well. So again, we heard a lot of feedback about those tools having a variety of issues, which is what led us down this path to explore another tool that may work better for us. So that's how we came to determine that the SIS would be a tool that we would want to explore. So the Supports Intensity Scale has been around for, I want to say we're approaching 20 years, but it is a validated tool that has been tested with over 150 individuals living in both the US and in Canada. So there's some reliability associated with the tool itself. There's a rigorous training for assessors. So some of the feedback that we heard, particularly from families, was they felt like the answers to the ODDP depended on who was doing the assessment. So we certainly wanted to sort of limit variability and have more reliability in the answers that we got. So the SIS will provide us with that. Our hope is that the SIS will replace the two previous tools that I mentioned to help us determine acuity, and to do it in a more informed way with better results that are more reliable. Our next steps in this process is to figure out where we can improve the assessment process and help it marry into existing newer tools like the OISP, and see where there's opportunities to change some processes to streamline the experience for the person served, to give better information to the SSAs, and at the end help deliver a better service plan. So that is where we are now, and I would assume that the work will take us some time to work through all of those issues and to really thoroughly explore and vet that. Through the process, we have had opportunities for individuals and families to give us their feedback through town halls. I would assume as we get farther down the road and the process continues, there will be additional opportunities for feedback. We also have an email box for anyone to submit questions, concern, and it is redesign@dodd.ohio.gov. So questions, concerns, certainly as Alan said, we will answer questions about modernization or anything else that was presented. Please feel free to reach out to that mailbox as well. I monitor it, some folks at Deloitte monitor it as well, so we are very responsive and will answer your questions to the best of our ability, or if not, show you resources where we can go, or at least work on getting you an answer.
Can I ask a question?
Yes.
While we're on the subject of it.
Sure.
Microphone.
Could you repeat the email address, please?
Yes, it's redesign at dodd.ohio.gov.
Okay, being that you're still working on the system and this new SIS, the problem with the ODDP that a lot of people have is the question, where do you live? Which really has nothing to do with the person's abilities or disabilities. And once they answer if they live at home with a family member, it goes from here to here. With this new system, will that change? Will that be a question?
It is not a question. And we heard that from a lot of people and agree that where you live doesn't determine what your needs are.
That's all I needed. Thank you.
I have a question.
Yeah.
I speak pretty loudly. The appro. Do you have a mic, or do you want me to stand up? Or?
We'll bring you a mic.
Thank you. I had two questions. One is the approval letters that people are going to be exempted from doing EVV. When do you expect those letters to come out?
My understanding of the process with Medicaid is you submit your letter. They haven't been real clear on how long it will take to get back to you.
That was
What I've heard without giving you specifics is it should be a quick turnaround. That was also said before letters started coming in, right? So I'm sure it's contingent on the volume of requests. What I will tell you is that the effective date of the exemption will be when you get the letter. That's been a question I've heard lots of folks ask. So I don't know if that was your question or not, but some folks say if I submit it today, will it be retroactive to the day I submitted? And that answer is no. It's the day that it's approved.
And it sounds. Where's my question? Well, I'll go to the other one anyway. My other question is with the GPS. We were sent forms for a client to fill out if they wanted it or whatever. So it's dependent on the client.
Yes.
Okay.
Yes.
So I think there was another question about that, if I think that I'll ask.
Behind you.
Hi. We were originally told that all of this would be completed by 2025. Do you foresee it being pushed out farther?
For waiver modernization?
For the ODDP, the
Yeah.
scale and all that stuff?
So what I'll tell you is converting to a new assessment tool will take some time. So we don't have hard and fast timelines at this point. But there'll be a period of time where we will need to assess folks and then normalize our results compared to what old results were to make sure that, we're making the correct assumptions. That could be a 6-month period or a 1-year period. So I think it's probably safe to assume that full implementation will not happen in 2025. But I'm hopeful that we'll be able to begin assessing people and collecting data well before that. But finalize, differences with acuities, et cetera, will have to come after we collect data.
Excuse me.
I'll be getting on.
So we saw them talk about the funding first. So let's say I live in a poor county, and I'm a parent and a provider, and my adult son has a funding range, the lowest funding range. They do the assess and determine he needs to quadruple the amount of funding. If we don't have the funding changes in place, how is that poor county gonna provide the match? So, correct me if I'm wrong, but it has to be a series. We've gotta find the money for the poor county and the ARC supports the new way we're gonna be allocating funds. So a wealthy county will, with this bank of money, help the poor county so they can increase the budget. When a parent doesn't get level 1 anymore, they'll be at a higher funding rate. Does that make sense?
Right. And there's a lot of details to work out in between, but I'm glad you added that, Gary, thank you. Because, again, that's what we're trying to do is, for the county board sustainability piece, is create a way where a county isn't financially vulnerable with a high cost waiver. Again, and that should promote more equity across the state and more opportunity for folks to utilize waiver services. So yeah, it's all a series of steps to get to the finish line. Appreciate that. Yes?
Are you ready?
Yep. Where are the town halls regarding the ODDP?
So they were virtual.
Are they still going on?
No, that work completed. So when we first started talking about the ODDP, those were in the spring of last year, is that? Yeah. So spring of 23, there were a series of town halls. Again, based on feedback, folks felt it would be easier to do it virtually versus, traveling an hour or two away to be in a meeting. So that's why we chose that
How
medium.
as parents do we get notifications?
Okay, I'm not trying to be rude, but I'm sitting here with the microphone.
Oh, I'm sorry.
Thank you. Appreciate it. So I have a few questions. First, I'm going to start with the ones about the EDD. I tirelessly, as an intelligent person in technology, have reached out to EDB. To this day, I have yet to receive a phone call from them. I went through hell to try to get my system mandated. And I read through, I couldn't even get to the training. It didn't even allow me to get to the training. I texted them, I emailed, I stayed on the phone for a week. Every driving distance for an hour, I called them. And it only resulted in rhetorical psychology. It wound up hanging up the phone. To this day, I've not got a phone call. Not. I think to me that if you hire an organization, we're accountable, they need to be accountable. And they're not. And we're mandated to follow their rules, but they're not mandated to help us. And that's an issue. I've got on the training, it never works the way that they say that they're according to their manual. It never works, it's a fluke thing. You may get on one day, you may not get on one day. You may get your reports one day, you may not get your reports one day. So, and to even sign in on your phone, it's like a 10-minute process. And so it's a lot of, things that I think that maybe whoever's mandating this should really take time to go through their system and understand how you can help us and go through it yourself and then understand how you can help us and then give us the tools for someone to be accountable to us if it's mandated. That's number one.
Just to be clear, it's being mandated by the Department of Medicaid and Congress, not by these guys.
And you know what? And I even emailed Medicaid, and guess what I got? Contact EDB. It's not on us. We're not the controllers of the situation. Trust me, I've emailed everybody that I can think of.
I know, and EDB is Medicaid.
And they told me to reach out to send data. I have all my emails. I mean, I spent numerous amounts of time. And
Well,
where
I'm just saying
I
Medicaid will be here at 2:30.
because it took time away from my clients for their mandation to be in place.
Yeah.
They have to have
Until later.
So let me say this really quick. I'm sorry for your frustration, and you are not alone in your frustration. We at the Department Department of DD have been in contact with ODM about user issues. Our call center has gotten a lot of calls and unfortunately can't help people navigate the system, which, you know, is not what we want to do, is push you off to yet another person. We know folks are very frustrated. So I do know that ODM has been trying to work on enhancing the customer experience. I know Sandata was dealing with a lot of issues, particularly right on July 1, with folks trying to get in touch and troubleshoot some issues they were having. And again, I think their call center had issues also where folks were being hung up on. So we are aware of those, and like I said, I apologize. And I do know that there's work being done to make that smoother and easier. Doesn't take away your frustration, other than appreciate your patience.
And I appreciate you saying that, but that being said, it doesn't resolve any issues, and you've also not addressed the situation. So, you know, that's what we do to people sometimes, to kind of like, you know, redirect them. And that's what I feel like is going on too, is that you're not addressing the issues.
Well, can I need to
You
add?
may.
They're not the Department of Medicaid.
Right. Okay.
They're not they have to redirect because they're not in charge of it. This is the Department of Developmental Disability.
Okay.
Yeah, but I
Now we'll
appreciate
move
it.
on.
Let's go on to the next one. Thank you.
Yeah, I understand the frustration. I worked 21 years in data processing around systems people. But like you say, Medicaid sends you to send data side and send data sends you back. And that goes on forever since July 3rd.
So with the EVB, ma'am, I know you're not Medicaid, but with the new thing they're merging together, the FMS, if you have your staff punching into their time, and they put who they're working with during that time to make it seamless, so they don't have to punch it twice, will that qualify for EVB? Will they take that report?
You're talking about the FMS?
Is that going to be a streamline for?
Yes, Guardian Track is working on becoming an alternate vendor. So you have to be approved as an alternate vendor to use something other than the Sandata system to collect EVB data. So I know that they're currently working on that. They aren't certified at this point, but that is the hope, that you'll have to clock in once or log in your visit one time instead of doing it
So
twice.
we use random paychecks as our, when we're punching it out. We're gonna have to switch over to them. It's still gonna be 2 punch-ins, right?
Are you providing participant-directed services? I just want to make sure I'm following so I give you the right information. Okay. I don't know anything about Rhino Bill.
Okay, so, you said Medicaid be here at 2:30? Okay,
Yeah.
I'll hold on.
Yeah. Probably a better person to ask.
So my question is, what about clinical therapeutic intervention and person-centered goods and services for the IO waiver? Is that going to be in the works?
Yeah, you can.
So we have heard requests for both the clinical therapeutic intervention service and person-directed goods and services to go into the IO waiver. We're thinking about those requests in line with all the other changes we want to make as well. So we don't have like a timeline to put either of those into the IO waiver, but know that we have heard that request and are thinking through the implications of all of that.
What does the future of the self-waiver look like right now? Is there any plans or?
So we don't have any self-specific plans. The plan we're making right now would be applicable to all of the waivers. I do think we want to, think through how to encourage people to use self-direction, and I would like to increase participation on the self-waiver. increase the participation of individuals using participant-directed services. So the self-waiver is important to our future. We don't have any specific self-waiver changes planned right now.
This is along the same lines with EDD, so I don't know if you guys know the answer, but, you know, the GPS, trying to get away from that. There's a lot of agencies, nursing and health aides, that use alternate systems that have been approved by the state of Ohio, so they didn't have to use EDD. The nursing agency we used was one of the first ones to be approved. How do we figure out getting the GPS turned off with them? I mean, it's collecting, like you just said, EDD data, but how are they even being educated that that's an option that their patients and clients have? That's one of my questions. Do you have any insight into that?
So I don't have any insight for that. I assume that as part of their alternate vendor certification process, agents or the alternate vendors will ultimately have to show that they are capable of doing that. I'm guessing those were all not ready for the July 1 change as well, so I don't know what their timeline for doing that is, but that's what my expectation would be.
I guess everyone should be treated equally, so that's not super acceptable in my opinion. The other question I wanted to clarify and ask this, you know, when we're talking about, and I'm glad that Gary brought up the funding issue and how the funding's been kind of be tried to spread more equally around the state. But I want to clarify, that is state funds that a county is going to, like, give up to give to another county. It's not local county dollars, correct?
So it is the sustainability work that we're doing is state funds that are currently allocated to counties that would be reallocated to reduce the risks to counties that have the more financial need. Right.
I know I've heard people talking about how can you take tax dollars from one county and give it to another, so that's something that people may want to be clarifying.
Yes, you've got that right. Thank you.
As